Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital. Welcome to Yale Cancer Answers with the director of the Yale Cancer Center, Dr. Eric Weiner. Yale Cancer Answers features conversations with oncologists and specialists who are on the forefront of the battle to fight cancer. This week it's a conversation about survivorship with Dr. Tara Sanft. Dr. Sanft is an associate professor of medicine in medical oncology and hematology at the Yale School of Medicine. Here's Dr. Weiner.
Before we get into some of the topic or the topics that we're going to be discussing, can you just tell us a little bit about yourself? How is it that you came to this field? What made you become an oncologist, and what drew you to both this area of patient experience and survivorship, which I tend to think are quite complementary?
Mm-hmm. Yeah, thank you. Well, I'm from a mid-sized town in Iowa. I'm a very Midwestern girl through and through. I have two siblings, and my parents now live in Minnesota, which is where they're originally from. And when I was 11, my uncle was 32, and he passed away from pancreas cancer. And he had two little kids, and at that time, there was, very few treatments to offer, and he tried some and they didn't work, and he passed away within a year of his diagnosis.
I'm so sorry.
Yeah, thank you.
And it's so young, particularly for pancreatic cancer.
It's really, my heart breaks for our patients. And at that time of my life, I was 11 years old. I didn't really understand everything that was going on, but I did know that the medical team who cared for him, and then eventually the home hospice team where he passed away at home, really supported my family. And there was something special there. And at that time, I decided I wanted to become a doctor. And I didn't know in my mind that I would end up in this field. But looking back, it was starting at a very young age. I really appreciated the relationships that doctors and patients could have, and especially in really difficult times.
Yeah. And of course, you're not a pancreatic cancer doctor, as it turns out. You are a breast cancer doctor. How did you decide to do that?
Well, so I did do training in oncology and palliative medicine at Northwestern in Chicago. And I enjoy the serious decisions that patients have to make and the end of life conversations, goals of care. But I also had a really good mentor there, and I started running marathons, and I wanted to understand the benefits of healthy decisions, healthy lifestyles as it relates to cancer treatment. And most of this work was being done in breast cancer patients. And my mentor there happened to be a breast cancer oncologist, and I kept coming back to his clinic and talking to the patients there. And so while I still do a lot of palliative care type conversations when I'm on the inpatient service, and of course, all my patients, we talk about goals of care when needed. I focused on my research efforts in terms of healthy diet and exercise, and that's really what got me into survivorship. That's where that field started. In the healthy diet and exercise research mostly started in cancer survivors, and I came here to work with Melinda Irwin, who is a world-renowned researcher in that field, and I still work with her to this day.
That's great. So let's talk about survivorship. 50 years ago, nobody thought about survivorship. They just wanted people to survive. And if you were so lucky to survive, you were really totally on your own. And any scars from treatment, any scars from the illness itself, and of course there can be many, were just swept under the rug, and you were supposed to be back to your normal self. So tell us what's happened with survivorship over these, let's say, past 20, 25 years, where it's become so much more a focus of what we do.
Yeah, I think you're exactly right, Eric. If you happen to survive cancer when treatments were evolving, you were made to feel very lucky about that, and many people did not survive. So patients really did feel grateful, and they still do to this day. But because the advances have gotten so staggeringly much better than they were. They're not good enough, but they're much better. We have, something like 18 million survivors, as of 2022 in the United States alone. And if you're diagnosed today, 50% of patients diagnosed are going to live at least 10 years. So the number of survivors is just projected to continue to grow, and for longer and longer periods of time. And so with that, people sort of finish their treatments and they have these moments of realization that I've just been through a lot and I'm not what I used to be. I don't feel the way I used to feel. I don't look the way I used to look. And we then sort of evolved into really dealing with things after treatment was over. We call it a new normal, which kind of bothers me because I think our responsibility is to try to mitigate that so that you're just your normal self.
Yeah. I mean, I've always thought of it that whether it's a medical issue or some other major event in your life, you go through it. For example, the birth of a child, a divorce, a huge job change. And these things affect us. We are, as people, the accumulation of the events that occur in our lives to some degree. And I think it would be foolish to think that someone could go through 3 months, 6 months, a year of cancer treatment and just, resume just where they were a year earlier. And yet people's families to this day still sort of expect it.
They expect it. And I think there's some patients who it's a little blip in their radar. And as far as they're concerned, they're not going to even acknowledge that was a major event. They're just going to keep going forward. So the survivorship term doesn't resonate with everyone, but for a not insignificant number, it does cause lots of reflection and side effects, unfortunately, physical, mental, spiritual, emotional, and family and financial side effects as well. And that's where, the field of survivorship recognizes the obligation to try to make people feel whole again or even thrive after cancer and its treatment so that they're able to reprioritize their life to live it even better than before.
So apart from just giving it a name and talking about survivorship and recognizing the importance, what are some of the biggest advances in the field over the past 10 years, 20 years? Take your pick.
Yeah, so I think to me, again, in my world, we've really advanced our knowledge as it relates to the role of health behaviors in cancer survivorship. So the issue of exercise, for instance, is probably got the strongest evidence with it. And like I said, a lot of that started in survivorship research. What about patients who exercised before cancer? Did they do better after? If they exercised after cancer, could they still do really well? And the answers are yes for many things. And those side effects that we induce with our treatments certainly are mitigated with exercise as an example. But we've gotten even better at understanding the role of exercise in various side effects and the dose intensity, if you will, and the types of exercises that can help. And we're still refining all of that. But to me, what this all means is that patients have some control over what their behaviors are and that cancer is a teachable moment. And as we even move forward, we're going to move all of these findings into the diagnostic period to try to, again, prevent loss of physical function from happening and prevent cancer-related fatigue from happening in the first place. So that's where we are right now. We still have some ways to go, but I see that as a huge advancement for the field, and it's one that's being really recognized, and hopefully we can even convince insurance to cover exercise programs for cancer patients because we know how well they do when they actually exercise.
Well, it does seem to be a bit absurd that we, of course, have insurance coverage for many unbelievably expensive new drugs that oftentimes are quite beneficial, sometimes are somewhat beneficial. But approaches like exercise and dietary counseling and psychosocial interventions, which are far less expensive, it seems like we have to go through jump through many hoops to try to get those kinds of services reimbursed.
Right. So I do think the culture is going to be changing. It used to be a nice to have, and I think it needs to be a must have. And I think any comprehensive cancer center understands that, and we just need the rest of the culture to catch up.
Now, the term survivorship has sort of been adjusted over the years. And at one time, we thought about survivorship as people who had completed cancer treatment and were presumably pretty likely to be cured. I think we think of it a little differently now. And could you comment on that?
Yeah. I will say that my understanding is way back in the 70s, patients were labeled as cancer victims. And yeah, so the term cancer survivor was meant to combat that idea. And there was a famous physician named Fitzhugh Mullen who published in the New England Journal in 1985, The Seasons of Survival. And he was a survivor himself. And he said survivorship starts at diagnosis. And he delegated it into certain phases. So it's different when you're in treatment versus right when you finish treatment and you're realizing you have a lot of things to deal with. And then long-term survivorship, probably that's a better label for people who've survived many years without a recurrence and they enter into like long-term surveillance. So I think survivors are meant to encompass anyone with a diagnosis of cancer. It's really meant to be from the diagnosis through the span of life. And again, recognizing that this is not a term that resonates with everyone. Not everybody agrees with it, but it is some way to describe this population that deserves these services, especially to try to make themselves feel better, during and after cancer treatment.
Sure. Now, in terms of the trajectory of survivorship, oftentimes patients will be going through a treatment for 3 months, 6 months, a year, what have you. Oftentimes there are many side effects with that treatment. They finish it and they think, I'm home free, life is going to be great again. And surprisingly to many of our patients, they find that transition time when they're done with treatment to be a pretty scary moment, one that at times they get depressed and anxious. Yeah. And what's going on there?
Well, I think that the post-treatment phase and entering into, this what we call extended survival, regardless of your diagnosis, there's several like unifying themes, and a lot of it can be a fear of recurrence, and also some anxiety and depression over having a lot of changes in life. We at Yale, I'll just mention, have a multidisciplinary clinic that's meant to see patients in this time between visits, right after treatment ends, and maybe in the first 3, 6, 9, or 12 months to really realize how we can optimize health going forward. So I think that it's a real phenomenon, and at least, almost 40% of patients suffer from depression, anxiety, cancer-related fatigue, loss of physical performance, insomnia, and that's where like a multidisciplinary clinic or specialists within a cancer center can really help get patients back on track.
Sure. Well, that's very helpful. We're going to take just a minute now, and we'll be back in shortly, and we'll continue our conversation with Tara Sanft, Chief Patient Experience Officer, Director of Survivorship at the Yale Cancer Center.
Support for Yale Cancer Answers comes from Smilow Cancer Hospital, where all patients have access to cutting-edge clinical trials at several convenient locations throughout the region. To learn more, visit smilowcancerhospital.org. The American Cancer Society estimates that more than 65,000 Americans will be diagnosed with head and neck cancer this year, making up about 4% of all cancers diagnosed. When detected early, however, head and neck cancers are easily treated and highly curable. Clinical trials are currently underway at federally designated comprehensive cancer centers, such as Yale Cancer Center and at Smilow Cancer Hospital, to test innovative new treatments for head and neck cancers. Yale Cancer Center was recently awarded grants from the National Institutes of Health to fund the Yale Head and Neck Cancer Specialized Program of Research Excellence, or SPORE, to address critical barriers to treatment of head and neck squamous cell carcinoma due to resistance to immune, DNA-damaging, and targeted therapy. More information is available at yalecancercenter.org. You're listening to Connecticut Public Radio.
Welcome back. This is Eric Weiner, the second half of Yale Cancer Answers for this evening. I'm here with my guest, Dr. Tara Sanft, Associate Professor of Medicine at Yale School of Medicine and Chief Patient Experience Officer. So, Tara, could you just expand a little further in this conversation about survivorship, about what kinds of services are available to survivors, not just at major medical centers, but in the community?
Yes. I will say that, again, because of the issues we talked about before regarding insurance reimbursement, a lot of these programs are can be inaccessible to people. And that's one of the things that I think we hope to change with our efforts at Yale. But within institutions, there's often programs that cancer survivors have direct access to because they're patients there. So those include oncology rehab services, physical therapy, dietitians, social workers who can oftentimes provide counseling and provide recommendations for further treatments of depression and anxiety. In the communities, there are organizations like the Live Strong at the Y program, which is a really creative, excellent program. If your local YMCA offers this and you're a cancer survivor, I highly suggest that you look into it. And it is a pretty comprehensive program for some number of weeks. I think it's 12 weeks, and it's geared towards cancer survivors to optimize their health. And as we've talked about before, a lot of that includes things like diet and exercise. But there's also a community there of survivors that naturally forms when people participate. And there's also places like Gilda's Club, or in Connecticut, we have a wonderful resource called Anne's Place that can help patients get connected with various services and support groups.
So I'm going to ask you to do what is almost the impossible. There's a certain negative connotation associated with elevator pitches, but I would actually like you to give me the elevator pitch to the cancer survivor, to the person who's had cancer, is either living with it or is past that diagnosis and is hoping to do well the rest of their life, still struggling with some of the aftermath of the diagnosis. And what would you tell them in terms of leading the best life they can at that moment?
Yeah. Well, I'm going to pretend you're one of my patients. And
please do.
I would say, listen, if you're struggling after cancer treatment, you are not alone. This is very normal for patients to feel completely untethered after cancer treatment. And there's lots of issues that can happen. And there's lots of people who want to help. And I will say, one size doesn't fit all. So this is not there's not one thing that you can do that's going to be right for everyone. So why don't we talk about what all is bothering you and try to get you into the most personalized response that we can and into a place of recovery so that, you start to feel better. I'll also say out of experience that these feelings and all of this doesn't last forever. There's a period of time and after which cancer won't be on the top of your mind every day. But if we can get that sooner, that relief of having to deal with the burden of being treated and the side effects, if we can get you relief sooner, let's do that. And let's take advantage of everything that we have.
That's great. And I think importantly, some of our patients will say, oh, I don't need help. I have 3 very close friends, or my family is very supportive. And I think one of the messages we sometimes have to communicate is that's great that you have these people, but sometimes there's a real role for some professional assistance and assistance from people who are not necessarily so intimately involved in your life.
Yeah. And, I'll just say that experts in cancer care, whatever field it is, they understand a broader landscape than arguably a few good friends, right? So they can really help share strategies that work for patients in similar situations because they are the experts in that field. For instance, a really good friend can help you feel better, but do they know about meaning-centered therapy and making sense of what you've just been through as it relates to the context and the story of your life? Our social workers know that, and they can help counsel patients on how to make meaning out of what just happened. And so that's just one small example of how the expertise, I think, is invaluable. And if you have access to it, why not help yourself?
Well, your other role, of course, is Chief Patient Experience Officer at Smilow. Patient experience is such a huge topic that I'd actually like to focus down on one specific area, at least to begin with, although we may spend most of the rest of the time talking about that. And that is the area of, I won't say physician, I'm going to specifically say clinician-patient communication. And I often tell people that when you're totally healthy, the part of your quality of life that is made up by your relationship with your medical team is tiny. It doesn't matter for many people who their primary care doctor is exactly, and they're just not having enough contact. But the minute you enter an illness situation, it becomes really important that that relationship with the healthcare team be right. And a lot of that is about communication. So talk to us a little bit about what you think patients want in terms of communication with their team and how we can get better at it. Because, of course, not all clinicians are created equally.
Yeah. So I think that, you're touching on something that when you become ill, that's a time of vulnerability. And so it's fine if everything's working well and you just need a little checkup. It doesn't feel as heavy. But when you're very vulnerable, and I would argue that cancer is one of the most vulnerable positions to be put into, you want to feel, and we know this from data, that patients want to feel seen, heard, and understood. They want to be known as a human, not just the patient with breast cancer down the hall. And, and I think that physicians and clinicians battling high burnout rates as a culture in medicine, that is the point that's why they got into the field that they went into, to help people. And they understand that these patients are very vulnerable and they want to make them feel seen, heard, and understood. Now, I would say that we didn't all learn communication skills the same way. And people say, yeah, but I'm really good at talking. But there's actual skills that we can practice and that we can employ with all patients that are much more likely to lead to better outcomes and better relationships if we just repeat those over and over again. And I'm happy to talk about some of those details.
Sure. I think hearing some of those details would be great. When I see patients who have come from some other facility, there are oftentimes people with cancer who adore their healthcare team and feel completely in sync and have had great communication. And there are times when it's just not as good. And I often wonder what, in those situations where it hasn't been as good, what's gone wrong?
Yeah, well, I think there's, again, a few things that we can do with every patient that sets us up for success. And, it sounds simple, but you really do need to be mindful about these things. So the first thing is to build rapport with a patient. And there's no better time to do that than right at the beginning of meeting them, which really means understanding who they are. And it can be a few go-to things like where they live, who they live with, what they do. Those are very simple. but also things like what's most important to them, or how have they handled, vulnerabilities or medical illnesses in the past. Building rapport builds trust. And it starts to change the relationship, because I think the clinicians also start to see that person as not just a new breast cancer patient, but, a teacher who came an hour away and is missing work and has a couple of kids at home, right? So those are very valuable things. And the second skill that we need to employ every time is listening without interruption. So, we might think that we're good at this, but this is a skill that we need to practice. And, research has shown that doctors in particular interrupt their patients around 11 seconds, which means that patients barely get their story out before.
Okay, you're done with that.
And even if it's something simple like, wait, when was that? Right? Like, I'm engaged. I want to know. Now you've just sent a signal. I'm in charge. I want to know an answer to a question. And also, we know that 80% of patients never get back to their train of thought once they're interrupted. So it's really important to let them tell their story. And I'll say one last fact. The vast majority of patients finish the bulk of their story and they do a natural pause by 90 seconds. So I know we all remember the big talkers who need to be interrupted at 5 minutes, but they're a small segment of the population.
Sure. And, I would argue that cancer in particular, but many other healthcare fields, are areas where if as a clinician, if as a physician, you don't like talking to people and hearing their stories, then maybe it's not quite the right role for you.
I think I agree with you. And I think that we kind of try to squeeze everybody into these round holes. And if you're a square peg, like there's value in all the cancer work that you're doing. It just might not be in the front line relationship.
Or it might be with some coaching from somebody who can help that person reevaluate their approach and learn some of these communication skills. And for that matter, and I'm curious about this, have you found that you have worked with physicians around communication, and that as a result of that work, they have come to enjoy their work and value it in a way that they didn't in the past?
Yeah, actually, I just a few weeks ago, I had a physician in our group mentioned to me that he changed his behavior after he went through a communication skills workshop. Again, we teach some pretty basic skills, but to him, it was life-changing. And it was the listening without interruption. He's a wonderful physician, has always been well-regarded, but to him, he would interrupt frequently, and he didn't realize that until he took the workshop and practiced the skills. And afterwards, it really changed his outlook. And I think that's not the only example. There's lots of people who say that it's really changed how they perceive their relationships with patients. It's strengthened them, which makes us enjoy our work even more.
Dr. Tara Sanft is an associate professor of medicine and medical oncology and hematology at the Yale School of Medicine. If you have questions, the address is canceranswers@yale.edu, and past editions of the program are available in audio and written form at yalecancercenter.org. We hope you'll join us next time to learn more about the fight against cancer. Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital.